My mother never had prenatal care. She was 16 years old. Korea, shortly after the war. She gave birth at home, a room really. No physician, no hospital, no monitors. Just my grandmother's hands. And here I am, decades later, an OBGYN who has attended thousands of births inside the most sophisticated medical system in the world. And I want to tell you something that took me 35 years to say out loud. My grandmother, with no training, no technology, no protocol, got something right that we get wrong every single day. She was present. She was connected. She knew my mother. That's it. That's the whole thing. I want to tell you about a patient. She's a composite, but I've seen her more times than I can count. 36 years old, first-time mom. Years of trying to conceive, fertility treatments, failures, finally IVF, finally a positive test. She walks into her first prenatal visit with everything on the line. And within that first appointment, she's told, because of your age and because of IVF, you're high risk. We recommend induction at 39 weeks. She nods, she signs. And because she trusts the system, and because she wants what's safest, because no one presented it as a choice. It was presented as fact. Fast forward 39 weeks, she's admitted. Cervical ripening begins. One method, then another, then yet another. A week later, a full week, she ends up with a cesarean with a diagnosis of failed induction. Mom is fine, baby is fine. By every clinical metric, this is a success. But that's not the whole story. Birth trauma isn't always about what went wrong medically. Sometimes it's what happened to a woman's sense of herself, her body, her voice, that week of induction, the procedures, the waiting, the hallway, decisions announced at the bedside. That leaves a mark, not in the chart, in her. Let me say something that doesn't get talked about enough. Membrane sweeping without permission. It happens. A provider reaches in during a routine exam and performs a procedure without asking, without explaining, without consent. That is not a small thing. That is a woman learning in one of the most intimate moments of her life that her body is a clinical object. Not a person, not a partner. And she says nothing. Because she doesn't know she had the right to. This is the system working exactly as designed. Efficient, moving, optimized. Just not for her. I've thought a lot about why I can't look away from this. Part of it is 35 years in the room. You see enough. You can't unsee it. But part of it is where I come from. I grew up without television, without indoor plumbing, raised by my grandmother in a simple world. You were kept warm, kept fed, kept connected to the people who loved you. That was medicine before medicine had a name. When I came to the United States at 12, I entered the world of systems, institutions, structures. And eventually I entered the biggest one of all, American healthcare. And I've spent my career watching it do to women what systems eventually do to everyone. It processes them. My grandmother didn't process my mother. She was with her. That's the standard I hold. This is why I believe in doulas. Not because they replace medical care. They don't. But because in a system where your nurse has 4 patients, where your OB may meet you for the first time during pushing, where decisions are made by people who don't know you. You need someone in that room whose only job is to know you, to notice when you go quiet, to stay when everyone else is moving. My grandmother was my mother's doula. She just didn't have the title. If you've been through something that didn't feel right, if you left the hospital with a healthy baby and still felt like something was taken from you, you're not wrong. You are not ungrateful. You're not dramatic. You experienced the system doing what systems do, and you deserved better. If you're heading into this, find someone who will stay, who will notice, who will speak when you can't. That's not a luxury. That's what my grandmother knew before any of us had the language for it.